Hello, I'm Shawn King with Freebird Body and Paint. I'd like to speak a little bit about our national health care. Don't quite understand why it is that we have the problems that we do with health care, as it seems to be a universal problem, not a political problem. I would like to see a universal health care system that everybody is involved in, that everybody has some coverage of some sort. Like, for instance, the Medicare system works well. Why not make that available to everybody? Everybody then would have a form of health care coverage spreading out the expense to everybody. As an employer, I don't receive any benefit from managing a health care plan other than retention of employees. But at the same time, I seem to be spending more money than I should or could if it were a broad-based plan spreading the expense over a greater number of people. The time that I spend isn't a great amount of time, but it is time. There's a monthly allocation for benefits, for premiums, collection and payment of said premiums. There's also a fair amount of time of my staff, receptionists, etc., to add and delete and make changes on people's personal health care within our plan. There's an annual negotiation with a new rate increase almost annually from our insurance agent, but there is some expense in accounting office, in accounting, in payroll that is never compensated for through our system, and it's just required as an employer to perform these duties. And I would like to see that be done in a different arena. Somebody else should be performing these duties, not the employer. It shouldn't be the employer's responsibility to make decisions about what type of plan you're going to have based upon what the employer can afford to pay and or what the employee can thus afford to pay. That should be available to each individual person in the country. I've been fortunate in that we've been busy and haven't had to lay anybody off for a number of years, but there are downturns in the economy. In those downturns, and there's situations where an employer would lay somebody off due to lack of work or lack of income coming in. And in that scenario, then they, of course, would be losing healthcare benefits, which is a great detriment to the employee and or his family. And it does cause a great deal of concern and angst for the employer. They are not in a position to continue paying for these services or this healthcare. And then again, they are stressed with the decision to lay them off. But it's a decision that must be made in some cases. In other cases, an employer may continue to pay for things even though they don't have the wherewithal or the money to do so, and also put themselves in a bad financial situation. You have my permission to use the video for healthcare working.
Thank you.